Excited to be here at Maui Derm 2025 talking about vitiligo. It's an exciting time for vitiligo. We've known about vitiligo for thousands of years. We've treated it for thousands of years. And it's only in the past 5 to 10 years we've really made significant progress in understanding what causes it and developing targeted therapies that work even better than older therapies, probably are safer. We're still learning about all that. One of the newer things that we discovered in the past year or two was that having vitiligo actually indicates that you have a very strong immune system. I guess that maybe isn't a surprise, but that indicates that the immune system is so strong that it can protect you against other things like infection and cancer and even heart disease. So it's been called the white armor, meaning if you have vitiligo, it actually protects you from a bunch of other stuff. And that study indicated that, that having vitiligo decreased the risk of all-cause mortality, essentially. That's what they concluded. So the risk of dying in the next 20 years was lower if you had vitiligo. Previously, the only FDA-approved treatment we had for vitiligo was a cream called monobenzone, and that actually depigmented your skin or removed the pigment. It eliminated the spots and made you all one color, but was not ideal, and so was not helpful for most patients. As of 2.5 years ago, we had the first FDA-approved therapy to repigment the skin, bring the pigment back, and that's topical ruxolitinib. Very exciting, that's a JAK inhibitor. JAK inhibitors are taking dermatology by storm, treating a lot of diseases. We have 4 other JAK inhibitors that are being tested orally for vitiligo. They're in phase 3, indicating that phase 2 worked. 3 out of the 4 are in phase 3. So that's very exciting. So we're hoping to have those in the next few years. And one of the challenges is that we discovered that when you stop therapy, even if they get a great response, you stop the treatment, vitiligo relapses. And it typically comes back in the same spot that it was before, indicating that there's memory in the skin. That memory, the source of that memory are autoreactive immune T cells called resident memory T cells in the skin. They stay there, they go to sleep if you treat them, they wake back up if you stop the treatment. So we learned that they rely on IL-15 or interleukin-15 for their survival. So if you block interleukin-15, you're able to erase them from the skin, erase the memory, and improve vitiligo without relapse. So that's pretty exciting. So we've got a drug that is in development. It's finishing phase 1 clinical trials, and we're hopeful for starting phase 2 this year. In addition to that, there are even more treatments that are being tested. It's a pretty exciting time, as I mentioned. In addition to that, my lab is developing RNA therapeutics for vitiligo. There is a type of RNA therapeutic called RNA interference, or short interfering RNAs called siRNAs. It can target any gene product, mRNA protein to turn off to treat disease. So we're developing a JAK1 siRNA that's pretty exciting. You can inject it into the skin for some diseases. You can even deliver it topically. So I talked about that. In addition, other people are coming up with other ideas, and so I think in the next 5 to 10 years, it's going to be a pretty exciting time for treating vitiligo. Also talked about the fact that it's really important to recognize when vitiligo patients have active disease. So a patient can come into your clinic and have stable disease, unchanging, no new spots, no growing spots in the past 6 months. If that's true, it's less urgent, and you can start slowly with topicals, work them up to narrowband UVB if necessary. But if they have active disease, that can spread very, very quickly, and it is very urgent. In my clinic, that's 20 to 30% of all my patients. When that happens, we like to treat orally. And so we don't have any FDA-approved therapeutics orally yet. We're using oral dexamethasone to do that. That stops the spread of the disease, and it gives you time to then start the topicals and narrowband UVB to get things under control. We think in the future, oral JAK inhibitors will probably be used for this, and biologics when they're developed as well. That's an important thing that we talked about. Surgical therapy for vitiligo for very stable patients who have segmental vitiligo, which is limited to one side of the body, are particularly amenable to a surgical treatment. So that's an option as well, and there are companies developing tools to make that surgery easier. Hopefully you're as excited as I am. That's a lot of stuff. I think I covered it all. And so sorry you missed the talk, but there's the bullet points to take home, and I hope to see you somewhere soon.